Hi everyone, this is Dr. Shim Ching, board certified plastic surgeon in Honolulu, Hawaii. I'm going to be talking to you today about how to get fast recovery from breast augmentation. Breast augmentation is probably the most common procedure that plastic surgeons perform in the United States today. Every year I place about 700 to 800 implants. As everybody who's seen my videos knows, I like to place the implants through an armpit incision because I feel that's the best way, and I call it scarless breast augmentation. Over the 25 years I've been performing plastic surgery, I'd like to share with you my tips for getting the best recovery from breast augmentation so we recover the fastest, because everybody who gets surgery nowadays really wants to recover quickly with the least amount of pain, least amount of downtime, and get back to what they enjoy doing and enjoy the results of breast augmentation. So I created this video to give the best advice to anybody who's watching this so they can get the fastest recovery and the least downtime from this procedure, which is a very common procedure for anybody who's searching on YouTube for advice. Yeah. If you listen all the way to the end, I will give you the absolute best tip for the best recovery after this procedure. So I talk about breast augmentation a lot in my videos, and anybody who wants a breast augmentation essentially wants larger breasts with the placement of an implant. There are other ways to do breast augmentation. This includes fat grafting, which is a whole different subject. So I'm going to focus in this video on breast augmentation through implants. Implant-based breast augmentation is the most common way to enhance a woman's breasts. And the placement of an implant, although very simple in concept, is a very complex maneuver that plastic surgeons do. And all the intricacies and subtleties and details of how you perform the surgery will influence result as well as recovery. So the very first tip is to follow your surgeon's directions precisely. All surgeons will go through a pre-operative process to really make sure that patients are completely healthy and ready for surgery. This includes blood work. This includes not eating anything the night before the surgery. This includes any other sort of preparation that your surgeon might do, which also includes not taking certain medications or supplements or vitamins. So listen to all these directions very carefully. Everybody has a different protocol. Your surgeon has selected the best things to do before his or her surgery, so listen to those specific instructions. Secondly, try not to Google too much about the procedure, because everybody's information on the internet is going to be very different than whatever you might experience or whatever you might need to do. So even though another surgeon says to do something different, it doesn't mean that you should do that. Again, if another patient has done something different in their surgery, it doesn't necessarily mean you need to do the same thing either. All surgeons do their surgery differently, and as a result, they may have different requirements or needs for you to follow before and after surgery. So trust your surgeon, because he or she is always going to want the best result and the best recovery and the best experience for you. Third thing, you can take certain supplements that can reduce bruising and swelling. And in my practice, I like to use arnica. Arnica is a homeopathic medication. We believe that it can reduce bruising and swelling. I do like to give it to all my patients because it's something that they can take, which is basically harmless, has really no side effects. The other supplement that I don't use, but other surgeons can use, is called bromelain. This is something that's found in pineapple, so some people believe that eating pineapple after surgery can reduce bruising and swelling. There is some evidence to indicate that bromelain can help. I don't recommend it, but it's something that you could probably try. And it's in the same kind of situation as arnica. It's harmless, minimal side effects, very safe to take, something that you can find in most health food stores or on Amazon. So something that you could add to your post-operative regimen as well. Next thing, choose your surgeon carefully. Now, your surgeon and how they do surgery, I strongly feel will influence your recovery and how you feel afterwards. Surgery that's done very precisely, where all bleeding within the breast is controlled with cautery, which is an electrical knife that also can coagulate blood vessels, is key to performing the surgery in a way that your recovery will be shorter. More bleeding, more trauma to the inside of your breast is going to increase the amount of bruising. Bruising causes pain. Swelling also is uncomfortable. More swelling will lead to more discomfort. More bruising and more swelling is going to give you more pain and more recovery. So it's really key for the surgeon to do everything very precisely, very carefully, very meticulously, and all those things will influence recovery. Similarly, how the surgeon does your breast augmentation is going to be very important as well. I like to do everything under direct vision, so I can see exactly what I'm doing, do everything very precisely, And not all surgeons do surgery that way, unfortunately. For example, armpit incisions. You can do the surgery two ways. One where you see what you're doing with a special camera called an endoscope and using an electrical knife called cautery, which I've explained. And doing the surgery that way is bloodless. There's no bleeding, it's very precise, and I feel recovery is much shorter than the other way of doing armpit breast augmentation, which is to use blunt instrumentation, where surgeon isn't seeing what they're doing. The space for the implant is forced open with very large blunt instruments. In my opinion, that's a more crude way to do surgery without the precision and causes more bleeding, swelling, and pain and recovery. So ask your surgeon how they're going to perform the procedure, because I feel that's very important and that will influence your recovery. So if you made it this far, I'm going to give you the most important tip to give you the best recovery, the shortest recovery after breast augmentation. And do you know what that is? That is your internal psychological state. Now, many things will influence how you feel after breast augmentation, and I want my patients to feel completely happy, secure, trusting that I did the surgery perfectly for them and everything has gone well and they don't need to worry about anything. And a lot of that comes down to how a surgeon communicates with the patient before the surgery, make sure that all questions are answered. The surgeon's team is spot on at taking care of the patient and making sure the patient feels totally cared for and has no questions or concerns or anxiety going into surgery. After seeing many patients who have gone through surgery like this, I can tell you that the calm, happy, less anxious, less nervous patient is just going to do so much better than other patients who are full of anxiety, very nervous after surgery, very that things didn't go well, because those patients seem to have more anxiety, and more anxiety, I feel, gives patients more pain. Now, this is going to be controversial. Not everybody's going to agree with this. But I really do feel the psychological state of a patient is key to a smoother, faster, more stress-free recovery. Not only does the surgeon and their team play a part in that, but also the patient. So make sure going into surgery that all your concerns, all your anxiety, everything is resolved before you actually show up for your surgery day. I, for one, would prefer to hear from a patient that they have concerns prior to surgery than afterwards, because I want to be able to reassure a patient that everything is going to go great during the surgery so that they feel better afterwards. So there you have it. That's really the most important tip that I can give to anybody who's getting breast augmentation. Trust your surgeon, ask all the questions you can, feel as good as you can going into surgery. Try not to Google too much, because that's just going to feed into your anxiety. Don't do that before surgery. Don't do that after surgery. Trust the process, trust your surgeon, trust that he or she has done the perfect job for you, and that will go so far in your recovery and you'll feel a lot better. So there you have it. These are some of the tips that I have for a patient going into breast augmentation surgery. I hope this is useful for you. If you did find this useful, please give us a comment down below, give us a like, subscribe to our channel, and we'll see you next time.